Welcome to our webinar on prediabetes. And today we are privileged to have Madam Veronica Kuita, who will be taking us through the subject of the day. She has vast experience in managing patients, both pediatric and adults, presenting the condition. So I suppose we'll have questions that may come in on the box, but at the same time also your engagement through contributing in the chat box also is highly welcome. So my name's Kihuku Wangereso, and therefore at this time, I suppose Veronica, you're good to go for the session. So I suppose as she on board, diabetes remains to be one of the key and communicable diseases that is affecting our country. And therefore, knowledge sharing, besides also the experiences from our respective areas of practice, you notice that we need to have concerted efforts on case management that would in itself also help in shaping, managing the condition, at the same time also reducing the associated consequences in terms of now the complications of care that actually tend to exacerbate the cost of managing diabetes as it relates to conditions such as kidney disease, loss of sight, and the rest of it. So in our today's session, I suppose we'll be able now to leverage on what the status is, and therefore even propose ways on how can we have the condition progressively managed so that now we can retard or rather reduce the associated complications that are taking a toll on our populations. So thank you very much, Madam Veronica. I suppose it's a high time you can take us through the session.
Good afternoon, everyone. My name is Veronica Kuita. I'm a diabetic educator, and we are going to discuss more about the diabetes and what is the cause. As introduction, we ask ourselves, did you know that millions of people around the world are living with the pre-diabetic without realizing it? In Kenya, the prevalence of pre-diabetic is rising due to urbanization, sedentary lifestyles, and dietary shifts. Pre-diabetic is a condition where blood glucose levels are higher than normal in cells, but not high enough to be classified as diabetes. The HbA1c, the normal range is below 6%. So when somebody is having more about 6.0 to 6.9, that's where we call or we name them pre-diabetic. Nutrition management is crucial in preventing progressive to type 2 diabetes. There is signs and symptoms of prediabetes, but mostly not everyone with the prediabetes shows symptoms. So regular testing is important even without noticeable signs. And there are silent signs. There is increase in appetite and hunger. Sometimes people can have dry mouth, even when they are taking their water. Sometimes it can also bring mood swings. It can lead to frequent urination, and it also leads to unexplained weight loss or gain. When somebody is pre-diabetic, they can also develop fatigue, unexplained fatigue. And also sometimes they can have numbness or tingling in their hands and feet, and also blood vision. We have the strategies for pre-diabetic management. in diet. And when it comes to the diet, we consider control of carbohydrate management first. So we advise choose low glycemic index food with whole grains. If it is ugali from whole maize, brown rice, sorghum, millets, and also legumes like beans, lentil, green grams. And we advise people to limit refined carbohydrates. Those are white bread, sugary snacks, and processed ugali flour. To prevent a case of pre-diabetic, we advise increased fiber intake, that is enough vegetable to our plate, which should consist of all type of vegetable, depends with the county or the community. Examples are sukuma wiki, spinach, and cabbage. And in part of fibers, we also advise fruits. Those who are allowed are apples, oranges, avocados in moderation. When it comes to fruits, we advise also the intake of orange or fruit juice should be taken in moderation. The best thing also need to reduce the intake, the pre-diabetic, is the intake of water. That is 8 glasses of water per day. Water help in glucose release. To avoid accumulation of glucose in the cells, we need water. It helps the person or anyone to decrease or to do away with glucose. We have protein choices. To have a complete diet, we advise for lean protein, the protein that is best for anyone. And examples are lean protein, that is fish, skinless chicken, plant-based protein, beans, peas, nuts, and also it's advisable to reduce processed meat. Avoid excessive usage of sausages, smokies, and fatty red meats. We need fat in our diets in moderation, and we also need to use unsaturated fats. The best one is from avocados, nuts, olive oil, and we also need to reduce unhealthy fats. That is, limit deep fried food, mandasi, chips, and trans fats, that is margarine and baked goods. It is very important to know that to have a good diet, we need to have portion control and meal timing. That is, eating small amount and a healthy diet, and it should be timely. Eat at the right time and the right diet. It should be avoid late night heavy meal to improve blood sugar control, because we know high metabolic is at night, and when somebody eats late hours, it interferes with the blood circulation, and also the accumulation of sugar usually occur. That is our rate where we need to advise our people to have high vegetable diet, small portion of carbohydrates, and also protein for a healthy diet. What are the lifestyle recommendations? We cannot do with the diet only to prevent pre-diabetes. It has to go together with physical activity. That is 30 minutes per day walking. If it is farming, also dancing is part of it, or swimming. Weight management is very important. We should reduce weight 5 to 10% to protect each and everyone from being diabetic. We have to do regular checkup of HbA1c once a year, which help us to know the glucose level inside the cell. Regular checkup of blood sugar, especially for high-risk individuals. Those are people living with diabetic family because of genetic, and also the people with gestational diabetic. It is also important to do regular checkup of cholesterol once a year to protect the release of glucose from fatty storage. That is our plate. Enough vegetable, carbohydrate, and small amount of carbohydrate. In our conclusion, pre-diabetic can be reversed with the proper diet and lifestyle changes. It is true, when high sugar is found in cells and some take a precaution of doing the right thing, eating the right amount, doing the exercises, it is always able to reverse. It is reversible. We also advise people to take Kenya traditional food, whole food, well-balanced diet, and this one will help them manage in blood sugar. We also need to do public health education, as I'm doing now, so that we can promote health eating habits, and also our people to understand that we can prevent type 2 diabetes. Thank you.
Thank you very much, Madam Veronica, for that short but on-point, precise presentation on the subject of prediabetes. And I suppose to all of us who are attending, we appreciate the fact that one, we've had the opportunity to get to know what predisposes us to diabetes. And then number two, and yes, it can be managed based on now the discussion that we put across. And then lastly, looking at the conclusion, you notice that you summed it very well, that prediabetes can be reversed with proper diet and lifestyle change. So basically, this is a wake-up call to each of us as healthcare professionals, wherever we are, not even now, because I know some may not be even healthcare professionals, that wherever you are, early screening, so the night can warrant detection is the way to go. And the basic test, like we mentioned, the once yearly HbA1c,
Yeah.
yes, a good entry point, just getting to pick your risk portfolio. And more so, you also talked about those high-risk individuals, mentioned the experienced mothers with diabetes, besides the individuals who are overweight or obese. So meaning, once you do your basic screening for basic anthropometry, like say the weight and height to get the body mass index, then it's a good entry point to that effect. So going forward now, it's a high time we look at the charts to get to see on what the questions that have come across. So maybe let's see what we have. There is Maurice Muchiri, who is asking, can diabetics itself be reversed entirely by diet management without conventional drugs? Maurice is asking, can diabetes itself be reversed entirely by diet management without conventional drugs? Yeah, so I think, can we reverse diabetes? Veronica, your take?
Yes, we can. When the HbA1c is 0.0 to 6.5, with the diet, it works. When it is above 6.5 to 6.9, sometimes doctors start some medication, but we have many clients which you have done well with the diet.
Yes, so you're assuring us that yes, possible. It is true that yes, you can reverse diabetes. But then now, as you mentioned rightly, doctor, depending on your HbA1c classification, then there are the two domains. That one, yes, diet and lifestyle alone. But then again,
And
for those with the extended values above, say 7, then some medication therapy is also required besides physical activity and exercise to help in making it holistic in reversing diabetes. Yeah, so, but then, of course, for this to be a success, it means there has to be a proper case referral system. So that now, once you come to them early, they'll be also able to intervene rightly. But again, most often than not, patients to the messaging is the family doing for the people who are reversing, but then they're not doing the recommendations as in the case. So of course, there is some cost in terms of making changes to usual lifestyle. There is the question on in lifestyle modification, loss of 15% weight, is it for the general population or specific individuals? Your take, Veronica?
For individual, those who are obese, at least the loss 5 to 10% should be well calculated for them to take care of themselves. It's not for the whole
General
population.
Okay,
It's
yeah.
individually realistic.
So yeah, thanks for that clarification. So as in the at-risk groups are now who are the express beneficiaries. But then of course, that's at-risk you mentioned the way to the beast. Maybe my colleague agree, you have your thoughts?
But I can weigh in on that in terms of when it comes to these aspects to do with weight loss, we should be concentrating more in terms of the aspect of the weight loss itself. Because remember, in weight loss, you can mask it. You can be losing fluids, which will translate to weight loss, or you can be losing muscle, which again will translate to weight loss. So which weight loss are we talking about? So that is what is becoming now key in terms of tracking the actual weight loss itself. Is what aspect of it? Are we losing fat or are we losing muscle? So that now, of which you'd want to be losing the fat bit and gaining the muscle. So that now you'll be able to ensure that your intervention is effective. So you're not just looking at generally the overall weight loss, you're looking at the specific bit in terms of now the weight loss. That's why ideally you'd want to invest in a body composition analyzer so that now it helps now to give you now targeted intervention. So that now if a patient is losing weight, you're actually being able to tell what weight is he actually losing or which weight is he actually losing, so that now you can be very specific in terms of the targeted intervention that you are instituting. Thank you.
Yeah, so thank you for that valuable input, because you notice that independently, even because you mentioned one of the signs and symptoms is also includes weight loss or weight gain. So independently, hyperglycemia, likely because of the increased urination, yes, you may lose weight, but then now you may have lost much of the fluid. And this therefore brings us to the aspect of what diagnostic tools we need to use in tracking or monitoring these clients or patients. That's why now the use of advanced equipment, like say the bioelectric body impedance analyzers, in-body analyzers, can come in handy in our facilities to help in actually tracking what is the actual loss. So that now once it is focused care, it becomes much easier to fast track the care of this patient and therefore see the results intended. Now, Daniel Ngure is asking, can kidney issues lead to diabetes? Can kidney issues lead to diabetes?
Thank you, Daniel, for that question. The type of question you're asking is more of a chicken and egg question. And most times we find that it is the diabetes, especially undiagnosed diabetes, that would lead to kidney complications. A lot of the time, especially in healthcare facilities, patients would manifest with kidney illness. But now on further investigation is when you realize, oh, there was underlying maybe diabetes, elevated HbA1c and such. So most times we tend to diagnose the diabetes as we are treating the complications. No, these complications are not just the kidney illnesses, disease, the complications from the eyes. So a patient has come in with the eye complications, they may not be able to, you hear daktari sioni vizuri, I cannot see well. So when you do the HbA1c, you find there was blood sugar elevation over the last few months. Also, we come with issues, especially surrounding men, you find sexual health issues. Then at that time is when the person is also diagnosed with diabetes. So we tend to find diabetes when, especially in the population, when complications have already arisen. We would really encourage, even as healthcare providers, in terms of community health, early screening. Pass by your local, know where you stand. Is your blood sugar within the ranges that are recommended? Take time to do your annual checkup, so that way you're able to pinpoint exactly where you are at any given time, so that these complications do not sneak up on you, as we might say. Thank you.
Thank you for that input, Madam Christine. Well, rightly put, you notice that number one, in kidney disease, there are stem conditions that would be of interest. Let's say in this case, let's say hypertension. So the stem treatment for let's say hypertension would be what would mask silent diabetes undiagnosed. So while in our facilities we may focus predominantly on say hypertension and kidney disease complications, you notice that now you're missing out on the other stem condition contributors, drug induced in the context of managing hypertension. But then number two, besides even the hypertension, you also notice that in the continuum of care of kidney patients, you notice, like say you've done a transplant, so anti-injection medication in some way also independently also contribute to glucose impaired management intolerance, which eventually now can flare up to diabetes full blown. And then also thirdly, in the context of say maybe managing tumors related to kidneys. So you notice that maybe in the context of use of steroid-based therapies, independently in isolation, also could contribute to the diabetes. So it's not really now that the kidney has contributed, but rather the side conditions which the patient was on that now are now predisposing to the manifestation, which means now in its entirety it's tied to matters, pharmacoinvolvement. The question from Ladies Nyakundi on what about when you're fasting and taking a meal in 24 hours, can it be a contributing factor for prediabetes? Veronica?
When you're fasting and taking a meal in 24 hours.
Can it be a contributing factor for prediabetes? Well, I think as she prepares to, she must have been having a problem with her microphone. When it comes to fasting, fasting is limited. As in, like, I doubt there's somebody who fasts across the 65. So it's a season period, therefore now limited chance of prediabetes. But then now if it becomes a lifestyle challenge, not now in the context of fasting, but rather a lifestyle of skipping meals, and therefore you only do one meal in a day, then issues of interest would be the glucose surges that happen when now you do mountainous, whether if you do mountains to compensate for the miss outs during the day. So obviously you also may tend to upset the pancreas in terms of the surges in glucose levels, which eventually again also having preconditioned your body now into energy conservation mode, then there is silent overall obesity that now starts to set in because now the body is going into conservation mode. This therefore accounts for silent overall obesity buildup that eventually now may become the issue around obesity now linking to prediabetes. So fasting is seasonal, but then now if your lifestyle is that of like say, resorting to fat diets, like say in terms of fasting, or more or less just once a meal, eating sessions, So in that regard, you find that there is really silent weight gain that comes in as you compensate for the meals once in a day. And now the worst bit of it is on the quality of the food at the time also when you're eating. In the context of one, the quantities, then number two, the richness in terms of the oil involved in cooking, the sugar therein, besides also salt. Top it up with the limited physical activity, they now may tend to exacerbate the risk of now transitioning to becoming overweight and obese, which are now the link express factors to the subject under consideration to diabetes. But then more so, you also notice that psychological stress accompanying the challenge you are in, because you see now it's like you're fighting your body rather than working with it. So you notice that now the psychological stress that can accompany the same independently would also up the risk of also now becoming diabetic. Thank you. Agree?
Well, I don't know what Dennis had in mind. Perhaps just as a by the way, I don't know whether he meant fasting, especially because we're in the Lent season and the Ramadan. So I don't know if that is the rider to the question, but I believe it has been explained in terms of it is not more of a one-off thing. It is more of a lifestyle kind of problem, because it all depends on now how much are you loading after you fasted. That is what becomes now a contributing factor now to the pre-diabetes. What are you loading with?
Accumulation.
Yes, so that would be now part of what might be contributing now to the pre-diabetes, especially like we're doing now, the fasting aspect. So I think we've tackled both ends in terms of if it were to be the usual fasting of the Lent season that we are in, or the Ramadan, and we've also done with now the one which is more of a prolonged period of time, what can be able to predispose you now to the pre-diabetes.
Correct.
On this topic.
Yeah, so the word is habits.
The habits.
Habits. Now we can't express link causes. Now there is an anonymous attendee who is asking for trans fats in margarine. Are we talking about Blue Band and Prestige? Because Blue Band has none, and Prestige was so little last I checked below 1. What modern common foods then contain trans fats? Also, what's your opinion on 10K steps a day for weight loss and low impact exercises? That is anonymous attendee. So the question is margarine. Are we talking about Blue Band and Prestige, which have none? The last time the person checked, it was below 1. So that's the first part of the question. So, Veronica.
That is a very interesting question. We would want to go back to, remember when we were learning about fats, we learned cis fats and trans fats. So cis fats are the fats that occurred naturally in the environment, while the trans fats are now
added.
The structure of a fat has been changed so that it could be more stable, more shelf stable. So that is how we tended to have certain brands containing trans fats. So the structure of the lipid was changed so that it could be more shelf stable. This was seen as beneficial then, but later it was discovered that these trans fats also act in the same way as the low density lipoproteins, what we would call in quotes the bad cholesterol. Now, maybe not speaking for manufacturers of any brand, but there may have been changes in how the fats are produced and how they are manufactured so that they can become more stable. That does not necessarily mean that that they are now good for you. It just means that the structure of the fat has been changed. Now, the structure of a fat or an oil can be changed through many things, including temperature. So, for example, if you are deep frying your fat, your chips or your whatever you're deep frying, your sausages, your chicken, whatever you like to deep fry, then you use a very good oil, you bought a very good quality oil, polyunsaturated oil that you can see through. So it's very good quality. But then you keep on heating and reheating, the structure of the fat changes. So now you had started with a good polyunsaturated fat, and now you end up with a fat that still looks like it is good for you because you started with that. But now the structure of the fat has changed to a trans fat. So that is something we need to look at. It is not really necessarily that this oil is good or this brand is good or this brand is bad. Is what are the habits surrounding? How much are we using? Because if we use, even if you're using the best oil that you could find, the best name to the best profile, but then you are deep frying all your foods, then it ceases to be what would be considered healthy or healthful for you. So that's something that we need to think about. So common foods, anything that is deep fried, most of the time, the fat will have changed structure to be a trans fat. Our opinion for 10K steps a day for weight loss and low impact exercises, our opinion is just get moving. Move. Whatever number of steps you do now, improve on that. Improve on your speed, improve on your distance. So if you're only able to make a few steps every day, tomorrow you make more steps or you make the same distance steps but faster, you are still doing good by your body. So we will not focus on the number of steps. What we focus on is continual improvement. I hope that answers your question. Thank you.
Thank you, Madam Christine, for taking us through the three domains of the question. But I suppose now from the first section, the key word here is moderation. But either way, notice that as part of industry interest in complying to regulations, because currently in the country you have what you're calling the front of pack labeling model, where now you need to look at what is contained. Initially, what you used to have is you just look at the nutrition facts. So you just look at the contents they are in. But then now moving a notch higher and now having an aspect of front of pack labeling where there are symbols attached to whether a food or a drink is termed to be healthy or not. So that's the direction you're going. But remember, as a part of near compliance, you may change the literature in the writing, but the content may remain static. And that's why to be too silent on the subject as a consumer, moderation is the key. And of course, now the suggested options for the natural alternatives, rather than now maybe doing avocado, imagine you do an avocado spray. Yes, so now in this case, you are literally near sure that you're able to go the right way. But then also, the challenge comes when you are pursuing value for money, where now you now start looking at the expiry date on the blue band or whichever now the brand. So you want to spread and clear, and therefore now increasing the risk portfolio than the intention. Yes, agree?
Just to talk on what we are discussing, it's not more or less how you label it, it is more or less of how do you use it. Because as Christine has already mentioned, if you're using perhaps, let's say the blue band, you're actually using it for cooking. You are subjecting it to higher temperatures, which is now transforming that fat to a different form. So you see now it all depends in terms of what is the storage mechanism that you're having, in terms of how are you storing it. Is it on where there is sunlight, where you're exposing it to, whereby you are melting, condensing it, melting, condensing it, so that now it changes now the form in terms of from what it was to something different. So it is multifaceted in terms of how you look at it, because someone perhaps would want you to say, okay, let's use this product because it is trans fat free. But now at the end of the day, how are you using that particular product? Because if you're subjecting it to an environment whereby you're using it not how it's supposed to be used, then you're actually simply transforming it to a different product that was not actually intended.
Okay, so thank you. Maybe my take on the 10K steps a day, the word here is get out of the comfort zone. Because now, like you crawled when you were young. So as you get into teenagehood, you start running. So go beyond comfort zone to notice or realize the benefits intended.
On the same thing on the 10K steps, remember there's a phrase that says, if you don't use it, you lose it. So in as much as you're working, you might not see the results tomorrow, a week after, a month down the line. But in the end of it all, the overall impact it is going to have, it's going to be very, very significant in that at the present, you're not seeing the impact itself. But had you not been doing those exercises, remember you're exercising the joints, you're exercising the muscles. So you are able to make them become much more stronger since you're utilizing them. But once you don't utilize them, you end up losing even the muscles that can be easily be able to be used to support you as you're doing now your daily activities. Plus, remember also, in as much as you're working, you're improving now in terms of oxygenation of the cells, you're improving the circulation within the body so that now even the nutrients are able to reach the cells. You're able to get a better health outcome at the end of the day, because it is also improving your immunity at the end of the day. So look at it from the positive aspect. The key thing will be the impact might not be an immediate impact, but the overall impact is going to have on you is going to be a very, very significant impact at the end of the day. So don't count the steps such that you want to see a weight loss or the next day or the next month. Because as you had already said, even in the previous, when you're talking about the weight loss, there are other markers you can actually be able to pinpoint for you in terms of what is the impact of the 10K step that you're doing actually. Because remember, I told you there's a shift in terms of looking at the overall weight loss. You might still maintain the weight as it is, but then now its composition has shifted. You've reduced significantly on your fat and gained more in terms of your muscle. You see, that is a good thing, as opposed to looking at just the weight loss itself, the way it is, just the gross bit in terms of it. So that is what I'd advise in terms of, don't look at the gross bit of it, look at now, what is the impact in terms of shifting it, in terms of the body composition? Has it had an effect? That is what we would want to focus more on, rather than just the general weight loss itself.
Yeah, thank you. Thank you. Yes, you said something.
Just that when you start incorporating these healthful habits into your lifestyle, the things that you first notice are not very obvious things. You'll notice, and those are the things that should be our goals. You'll notice that you're able to maybe walk faster. And previously that distance was a struggle. That already in itself gives you a marker of improvement, whether or not the scale has moved. Look at your clothes, how the shift in how they fit. Already that is a marker. And focusing on those things, the things that impact your lifestyle, the things that show you're being fruitful in your endeavors, without focusing on the scale, has higher benefits, because then now you're motivated to continue. Sometimes, especially when the scale does not move, we tend to feel discouraged. So it's very important to now focus on the non-weight, non-clinical features of good health. Then we're able to move forward with a better attitude and a mindset.
I can see Robert has raised his hand. Robert, your comment?
I want to narrow it on diabetic patient, now that it was a general view on weight loss. But now with diabetes, you need actually to be cautious on in terms of the kind of exercise you are doing. Again, on the duration of also doing the exercise and what you should do. For instance, if you are experiencing hypoglycemia and you want to do 10 steps without a precautionary measures, knowing that sugars can come down anytime, what are some of the first aids that you need to do, especially when the sugars comes down? Actually, you need to be very cautious about it. Don't just do it. We are not doing, we are not prescribing an exercise for the general population, but we are individualizing it based on how your sugar is responding. And in terms of diabetes management, one of the component is also the aspect of exercise. Very, very, very important. And you don't copy paste the information that the information that is for one person and paste on your side that this is now the general view on the management of diabetes based on exercise as a component of it. But you need to have a one-on-one discussion on how you can do the exercise as a person who is affected by diabetes. Some has different BMI ranges as per the scale, and that prescribes or the kind of exercise, the kind of the goals that we have in terms of do you really want to gain weight or do you want really to reduce weight? Another informing factor is the insulin, the kind of medication that you are putting in. We have long-acting insulin, then short-acting. Then we have also all those arrangements. One may promote weight gain, some don't promote weight gain, and therefore we need to understand all those parameters, all those aspects of management, so that we can make a conclusive dietary recommendation based on all those factors. Thank you.
Yeah, thank you, Dr. Robert. So you notice that the discussions that have actually rotated around that subject means from the word go, proper case referral, so that now it is tailor-made, custom to the person, so that now we can get the intended output real time based on individualized care. There is the question on what's the best cooking oil for use at home. There are so many stories online on cooking oil, and it's confusing. Robert.
Cooking oils can be obtained through two main sources. We have plant-based and animal-based. The animal-based is the trans fat, the cis fat, sorry, the saturated one, and from plant source is the unsaturated and polyunsaturated fats based on different classification. Theoretically, or when you go back to school, you are being told on how you can classify fats based on maybe the state in at room temperature, the source, the kind of the chain length. All those are just theories. But the major thing is, are you obtaining it from the plant source or animal source? Now, I encourage people to use the oils that is obtained from the plant source as opposed to animal source, because many studies have shown that the long use of animal-based fat is contributing to a state of we call diseases such as hypertension, obesity, while the other plants also are a good source of cholesterol, which actually is being transported away from the heart for excretion and decomposition and the excretion. And therefore, we are saying that in layman's way, we say that anything that any oil that is so liquid at room temperature is much better as opposed to those that are solids at room temperature. And remember, there is a way on how manufacturers convert the liquids to oils again, so that they can make it easy for packaging, transporting, and also increasing the shelf life, as my colleague had told you about it later on. Yeah.
Okay, thank you, Robert. But then now maybe the word here is don't read stories online. Ask the experts. Visit a nearby facility. We have nutritionists across the country, dietitians who can actually handle the subject rightly. But either way, while having even mentioned the aspect of using liquid oils, remember the method of use and the quantity in use also may counter the health benefits attached. So it still takes us to the question of, or the aspect of moderation is key. So that you don't now invest in a brand because it's liquid, but then now you're defrying everything. So meaning actually the intended benefit becomes negligible. Right. I see questions are still coming in. Can you speak on the ketogenic diet? That is Daisy Ogoya. Can you speak on the ketogenic diet and its effects on diabetes?
Thank you.
Veronica?
Thank you, Daisy. When it comes to diabetic management, as professional nutritionists, we advise patients to eat a healthy diet. What is a healthy diet? It complements each and every food. The food has to get protein and carbohydrates, vitamin, fat, and water. We don't advise our patient to use ketogenic diet. Reason, each and every food complement one another. For a person to use protein, it can work better for some vitamin when a person is using carbohydrates. We don't go with one type of food because also we advise patients to have a normal life. Diabetic diet is just a normal health diet that will be easy to work with during her lifestyle or his lifestyle. So it has to be a complete diet which will compose each and every part of food. Remember, when you're advising our patient, there are essential minerals and they have to work together with carbohydrates to be used by the body. So our patient have to eat a healthy diet that comprise each and every type of food. When you deal with the ketogenic diet, you advise your patient not to feed some type of food, which also has high degrees of side effects. That is not good for a diabetic patient. So let us advise our patient to eat a healthy diet that comprise each and every type of food that will make our patient live a happier life without being stressed by the diet. That's my take.
Thank you for reminding us of basic biology, that in terms of classifying macronutrients, carbohydrates are for energy. So you say no carbohydrates, you only now do protein and fat alone, then the body will resort to gluconeogenesis. So now it's converting glucose from the other forms of macronutrients for basic survival. And of course, insulin is protein-based. So you need a protein source to also augment the function besides matter, stir, and wear. Fat, yes, energy reserve, but again also for absorption of vitamin A, D, and K, besides that the rest. So you notice that it should be holistic. Balance is key, as was encapsulated in the statement, portion control. So remember, you don't struggle to manage conditions like, say, DKA if you also potentiated the upset. So ideally, look at the client holistically. That what are some of the complaints that come in patients with diabetes? Yes, they may not have been on keto diet, but again, now remember how the reversing even DKA becomes near problematic due to the buildup of ketones. And therefore, we've seen cases of maybe acute kidney injury, some even becoming of progressive renal failure with time. So as in, refer for proper information knowledge. Agree?
Just an additional to aspects to the ketogenic diet. As you'd realize, ketogenic diet was not necessarily meant for management of diabetes. So the key thing would be, in as much as someone would want to do a ketogenic diet, to some extent, it only works if at all it is for a shorter, it is being used more for a short-term period, not necessarily a long-term lifestyle for the patient. Because you realize, for you to be on a ketogenic diet and you're diabetic, you need to be doing it under medical supervision. So it's not something that you're going to be doing it alone, as you'd want to sort of like think that it is curing your your diabetes. Because remember, you have different types of diabetes. There's type 1 diabetes and there's type 2 diabetes. So it would be prudent for you to be able to match who would actually benefit from using short-term ketogenic diet as opposed to shifting to using ketogenic diet in management of all your diabetic patients. That is where now the risks comes in, because remember, in as much as you're going to institute that ketogenic diet, there has to be aspects in adjustments of the medication of the patient themselves. So there has to be that discussion, there has to be an agreement, there has to be a teamwork effort between the patient, the dietitian, together with now the clinician, who is now the endocrinologist who will be seeing the patient. So that now you agree, because it has to be more of an agreement. It's not more or less of one is making a choice, the other one is not even in the know. So it has to be a teamwork discussion whereby you're saying we are going to be doing this with targeted aspects in that particular management. But I would advocate it to be used for a long-term period of time because of its inadequacies, especially when it comes to aspects to do with micronutrient deficiencies in your patient. So it has to be something that is done under medical supervision. So I would encourage a diabetic patient to onboard himself in a ketogenic diet without seeking the relevant expertise, so that they may be able to advise whether that would be appropriate for them, depending with the nature of or the type of diabetes that they are suffering from. Thank you.
Thank you. I think the one way is clear. Once you become a bit obese, you don't jump back to your initial weight. You walk to your current weight. You also need to walk back to where your usual weight. Thank you. So it's a journey, not a reaction. Act, don't react. Christine, is gaining weight in the lower or upper stomach a sign of prediabetes?
Wow, that is quite an interesting question. Oh, now since the individual asking may not be here for us to determine which part is up and which part is lower, we might answer this question in terms of what we refer to as central obesity. So central obesity or abdominal obesity is now excess accumulation of fat around the abdomen. Now, there's not just the fat that you can see, subcutaneous fat, but this also includes the visceral fat. So fat around the stomach and the internal organs. You would know that you have central obesity if you are a male person. Look at yourself, look at your waist, stand up. Is your belt pointing forward or is it pointing the floor? No, let's just no, it's a good way to look at it. Stand up, look at it. Where is your belt pointing? But in terms of measurements, as a male person, your waist circumference should not be more than 94 centimeters for a man and 80 centimeters for women. Otherwise, if it is, then it is a major risk for cardiovascular disease. Now, this is because now the visceral fat and the high metabolic, it has a very high metabolic activity. So it releases those toxins that are known to cause inflammations and increased risks for hypertension, heart disease, and stroke. Now, when we're looking at our patients, there is what we tend to look at as just part of the triad. Is more, we look at a triad, like we consider a few things, because most of us, even though we are having a conversation around diabetes, and hyperglycemia also features as part of what we call the metabolic syndrome. So metabolic syndrome would be the existence of at least 3 of the following things: hypertension, 1, or high blood pressure. Your blood pressure is elevated. Abdominal obesity, so the high belly fat. Hyperglycemia, now the high blood sugar. and low healthy cholesterol, low good, what we consider the good cholesterol, the HDL, and then high triglycerides. So most of the time, these things would be looked at independently. You'd come and say, oh, wow, today you are now have high blood sugar. Or tomorrow, now, oh my goodness, now the pressures are high. We tend to look at them very separately and tend to diagnose them separately and treat them separately. But understanding that these are also, they're sisters, they're not just friends. They tend to coexist in the same individual, and also they tend to, you're predisposed to the same things through the same channels, the same lifestyle choices, the high processed food diets, the high carbohydrate diets, sedentary lifestyles. So fundamentally, the gaining of the, when you're looking at it from an aspect of metabolic disease, might be a sign of something that is happening within your body, and you might need to be checked for that. That being said, we might be looking at other things. Somebody might be getting ascites, an inflamed liver, fatty liver that has hepatomegaly. So it is important that when you notice changes in your body, get them checked out. So, or even in your client's body, look further, see what is happening within their system so that you may be able to treat them effectively. Sio kitambi yote ni kunona peke yake. Not all big stomachs are just obesity. Sometimes there might be other underlying issues.
Yeah, thank you very much, Christine. So I suppose the key word here is don't be convinced by positionality. That mine is lower or upper, therefore minimal or no risk. Because remember, either way, even if it was in the upper stomach, still there are organs attached to that space. So meaning even respiratory competence, besides issues around reflux also setting in, which also by themselves also become a discomfort. So the word here is achieve the desired weight. Otherwise, you'll struggle in either direction besides the location of the obesity. Someone is asking, the presentation mentioned portion control. How would we advise patients on portion control so that they can maintain adequate nutrition? That's the part one of the question. How do we advise patients on portion control so that they maintain adequate nutrition? Veronica?
Thanks so much. When it comes to portion control, let us remember what we had said earlier. What is pre-diabetic? It is the accumulation of glucose in the cells and also excess intake of carbohydrates. When it comes to portion control, we are supposed as a profession to advise patients to take a healthy diet that contains the protein, carbohydrates, vitamins, and water. And when we are doing the portion control, we have to calculate the amount depending with the age. We have to consider the age, the activity of individual. So it cannot be specific for one person. You have many things to consider: the activities, the age, the where somebody is working. So, but the key thing is the portion, the plate, like the one you had shown earlier. It has to contain the full amount of vegetable and the protein and starch and also the water. But the most key things is we have to calculate the portion using the activity and we consider the age.
Yeah, thank you. So you mentioned the plate method. There is the Zimbabwe hand jive. It is also even the household measures, including, let's say, cups or exchanges. So that now in this case, they can be custom based on the calculated daily requirements for that person. But then this actually has to come out from a trained professional who can actually thrash through these details further. So how do you manage the transitionary phase? So assuming now somebody was eating liberally, but then now you want to manage them to transition. I think I would ask you to respond to this. I'll say, just like the diagnosis comes your way that you're diabetic, and now there is a transition around now you do a quarter tablet of glucomate, and then now transition to half and therefore do full dose. So communicate right that this is where you are, this is where you need to go through contracting, so that eventually at the end of it, or remember you are communicating for the interest of benefiting the patient. So negotiations come in if you doubt on the therapy, but then if it's clear that this is what you require for the benefit of your health, then just be succinct, be definitive in care, so that now mgonjwa atekeleze anayostahili kufanya, kwa sababu ni kwa ajili ya manufaa kwao. So with patient having hypothyroidism and diabetes, what other protein sources would you recommend in vegetarians? In patients having hypothyroidism and diabetes, what other protein sources would you recommend in vegetarians? Kemboi.
Thank you, Anisha, for the question. I think patients with hypothyroidism, that means the iodine levels are low. And when there is low levels of iodine, they tend to swell on the upper side of the jaw or the neck. And therefore, the body actually is trying to communicate that we need more iodine. And that communicates also to the body that there is need of iodine. And the body is trying to acquire more iodine from other parts of the immune system. Now, when we start with diabetes, there is no specific proteins that are recommended for the same patients with diabetes and hypothyroidism. And rather, for vegetarians, we are saying that you need actually to be informed by the information that you are being given by a trained professional on dieting aspect. You don't need just to be a vegetarian by aspect that you have learned this from the internet, and therefore your Google is your teacher. We can get more complication that results from that, especially on the vegetarian. Maybe your system will not be getting enough of the proteins or any other nutrients that are required by the body. More so on the protein aspect. Depending also on the age, the protein requirements are very high. And therefore, let's take proteins in the right proportion to other nutrients so that your body can get well nourished. Thank you.
Thank you, Robert. I suppose maybe Anisha was in the interest of looking at vegetarians, therefore risk of B12 deficiency that may tend to be a risk in that population. So you find that it's necessary that supplemental B12 be prescribed just to help in augmenting the deficit. Yes, if that's the direction he or she was heading to, but then either way, whether hypothyroidism in diabetes, no limitation. But when it's defined vegan, then now supplementation comes in. So though we are rushing against time, we have an anonymous saying, kindly elaborate on how fatty meat from the presentation can lead to diabetes, considering that those who use tallow for cooking. So I suppose this one must be coming from Turkana or Masai land. So the assumption is they do use tallow in cooking, and therefore, but then diabetics. I suppose now, in referencing to tallow, remember, look at maybe the activity portfolio of the communities I've just preempted on. That these are herders, long distance, which means the activity portfolio is super. To me, who is sitting in Nairobi, in an office at this moment, will take a motorbike to the house, or maybe a public means of transport, or an Uber, whichever the means. refuel in the evening, maybe because also I skipped meals during the day. So then I go to bed, meaning minimal physical activity. But again, also the dose in cooking, because you see now minimalistic approaches also apply, so that you use less for long-term matters, survivability. So in this case, you notice that you may not classically associate the community of interest to your portfolio in the context of the environment where we are living in. Now, more or less, look at the wild fruits and even veggies or even juices or concoctions. Some of these communities also swallow along the highway, not really the highway, but rather in the bushes, which means also it tends also to buffer up on their fiber intake besides hydration. So meaning in this case, if there is any awaiting to be absorbed, then it is flushed out through the binding effect of what? Fiber on lipids, in particular now cholesterol within absorption. So basically, yes, fatty meat, remember additional energy, better taste, biases in terms of choices, increased organic quantities to clear the servings. So which means, in its entirety, besides also having salted it means now bias and therefore boredom in the event now it was lean cuts. This is what entertains the meat joints. The savory nature of the dripping fat in charcoal is what actually invites you there. So you eat more to also go with your contribution home. But you see now the negative effect is limited physical activity. Number two, too much salt, a lot of calorie density in terms of now the fatty nature of the cuts. And therefore, the more often now you make it a routine, therefore the predisposition to matters, weight gain. So don't tie it to the community. Remember, contexts are very divergent. Therefore, you cannot compare. Speak on fruits. There is so much misinformation on fruits increasing sugar and veggies like carrots. Veronica?
Yes. Thanks so much, Eric. When you discuss about food, we have talked about pre-diabetic, storing of excess carbohydrates, glucose. The fruits also has fructose, which is converted to glucose when it reaches to our body. When you talk about nutrition in each and every food, we emphasize on portion or serving. Every type of food has some amount of glucose. With the fruits, there is grams of carbohydrate in certain fruits, and it differs with the fruits. If we classify fruits, there are those with high carbohydrates, there are those with less carbohydrates. That's why we advise our patients that they are supposed to use portion or control. We are not supposed to take too much of fruits or fruit juice, because the end of the products will be converted to glucose. It's all about portion. When it comes to fruits, when it comes to the intake of food. Thank you.
So thank you, Veronica. I think in the interest of time, I suppose the questions now, some that are remaining will be answered live. But then either way, as you noticed that, yes, from the discussions, there is so much to be shared. And therefore, the take-home message of interest is reach out to the healthcare professionals for guidance, in this particular case, nutritionists and dietitians, from wherever you are, so that now they can thrash out on the issues, clarify the concerns, in the interest of responding to our concerns. So the remaining questions will be answered live, so that in the context, as in we'll just do the typing, so that now at the end of it all, we have to respond to your needs. Thank you very much. We have got 10 more minutes to go. Yeah, I'm told there is 10 more minutes. Maybe we can pick on a question or two. Is there something like your body getting used to a particular exercise, e.g. walking, does need for diversifying types of exercise? I think we talked about intensity with time. So build on the intensity so that now you get out of the comfort zone. So you know that the legs are used to, but it's the mind that has settled into a comfort zone. And this actually may explain the plateauing, especially for individuals who want to lose weight.
That's
the oil to use at home is controversial. The so-called seed oil isn't so and some nations recommend animal oils. I think capacity building, awareness creation, and more further cross-table interactions will help in actually demystifying some of those myths attached to the oils. But then the word here is, we talked about this moderation, but again also ask and learn from them, especially around you. Mary Kamau, now that tallow is said to be more stable, hence best for frying, just like coconut. Kindly clarify. I think we talked about tallow, that the hype around tallow is community-based.
And there have been certain conversations around new research emerging, but let us first have this in mind, that moderation is key. No matter what you are using, at the end of it, just maybe about 5 grams of whatever fat you're using is not what is going to make or break your health. But then, if you're talking about tallow, so that we can maybe increase the percentage of fat in our meat base, that may be different. And remember, our genetic compositions are also different. We have people who are super producers of cholesterol, innate cholesterol. So if people are innate cholesterol producers, and then you have increased the amount of fat that they're taking in, that they may respond differently. So let us carry most of these recommendations that we have, not as blanket recommendations for the whole population, but as more of guidelines towards food is best when you use what is available to you in moderation.
Thank you, Christine. Thank you. Ruth Mugo is asking advice on fruits. I suppose you mentioned that fructose and therefore moderation is key. So there is misconception of use of honey instead of sugar. Honey still has glucose, but again, also you're using honey to improve on the taste of bread or even tea. So obviously, also you have a bias, you eat more, and therefore delay your glucose targets. So thank you, everyone, for you staying live with us. I suppose we can stop there for now until next time, God allowing. So there are those who asked about matters relationship with cancer and diabetes, other topics. We'll actually cover them as we go along in the subsequent. Thank you. Bye-bye.